Today I'd like to talk about mentors and mentees. In healthcare, in business, in life, we talk a lot about how important it is to work hard, get great grades, get your certifications, get your licenses, cross your T's, dot your I's, and all that quantitative stuff is super critical, but we never stop and think about the qualitative. And it's critical to think about the people who have helped us move beyond our limitations. And so take a moment and think about the people in your own life, whether it's personally or professionally, that have made a difference, that have helped you push beyond your normal limits, push beyond a moment or a point at which you felt, I could do more, I can't go past this point. And in healthcare, that's so critical because, there are very few professions, very few focuses in life that demand expertise. And I don't mean expertise like being good at your job. I mean demand an air of expertise, demand that you both are an expert and exude expertise, that people see you as an expert, that people see you not necessarily all the way up on a pedestal, but that they see you in a very, very, very important way. And because of that, oftentimes we run into the issue of, hitting peaks, hitting moments where our skill level gets to a certain point, and for it to go any further, somebody needs to come in and critique us. And that becomes super, super critical. So one example of this is an article that I read by a surgeon. And this was one of the most famous surgeons in the entire world, specific to plastic surgery and doing reconstructive work. So burn victims, that kind of thing. And, this person thought they were at the top of their game. And so they were recommended by someone to bring a coach in. And the coach was actually someone who was also a plastic surgeon, but not nearly as accomplished. And so the plastic surgeon was a little surprised, but decided to go along with it. And the plastic surgeon, basically the way it worked was the coach came in and started watching surgeries and taking notes. And it turns out that there was actually critique to the surgeon's, I guess, dismay. But the coach basically had things to say that the surgeon wasn't so excited about. But it turns out that as a result of those efforts, as a result of that coaching, that surgeon's performance actually increased. His percentage of successful surgeries and his ability to create better results improved. And a lot of that comes from a willingness to seek that kind of improvement, the willingness to explore opportunities for improving our skills. And so when we think about our skill set, that's one thing. The second part of that is our presence, is how we're perceived. And when you're a practice owner, when you're a business owner, perception is everything. And you want to be perceived, I think, genuinely. You want to be perceived in a genuine way. And you may be genuinely different from someone who is genuine in a different way. But you want to be sincere. You want to be you. And a coach, a consultant, can help bring that out. One of the biggest things that you come across is the fabricated response, right? The coach, the consultant, the practice owner, the clinician who basically doesn't know what to say, and so they calculate everything in their head. They think about what they're going to say, and which is, you should absolutely think before you say things, but everything comes across very calculated. Everything comes across very carefully coordinated. You find, I was at a conference with a gentleman, with a clinician who spoke in front of about 1,000 people, and this person was a fellow speaker and had survived brain cancer. It's an amazing story. Had survived brain cancer, was on chemo, was on all kinds of medications, and I I won't cheapen his story by trying to tell it, but the bottom line was that his presence, his force of will was incredible, and it makes an impression. And so your presence becomes so critical to what you do, so that people not only experience you as the expert, but they also feel you as the expert. And when you're trying to build a community, it's critical that you are not only the expert, but also perceived that way. And it actually goes a step further, and this is where we'll kind of end for today, but the last step of this is creating experts, is actually taking that expert position you have, both procedurally and by presence, and transmitting that to your staff, transmitting that even to your patients, transmitting that to your clients, so that not only are you perceived as an expert, but you're perceived as a creator of experts. You know, kind of like what we do here at POI, where we actually help consultants, bill co-owners, billing company owners, coaches, basically take what they know, what they're experts in, create that expert presence, and take it to the third level. And so, I mean, when you think about experts, make sure that you're not just attaching yourself to someone who is an expert in what they do, but someone who's an expert in what they do, exudes that expert presence in a humble way, and is happy and willing and excited and passionate about sharing that expertise and creating that expertise.